And now, Wellness Wednesday, brought to you by ExpressCare Urgent Care Centers, a LifeBridge health partner.
It is Wellness Wednesday, and today we're joined by Andrew Hodge, Physician Assistant and Clinical Director of Wellness at ExpressCare Wellness Center.
And he's here to help us better understand the benefits of testosterone replacement and who may be a good candidate and why maybe go through medical evaluation to kind of start the process. And thank you so much for joining us. We were saying that, I don't know what it is. Everything that is men's health related comes with a stigma. Men do not want to hear any kind of news that's not good.
Men are terrible about it. They're terrible about seeking health care, going to see the doctor. There's a lot of barriers there. So one thing we're trying to do is make it a comfortable, easy process for men to come in.
Great.
Yeah, and so speaking of this topic of low testosterone, what are some of those signs and symptoms somebody should be looking out for?
Yeah, I mean, testosterone is not just about muscle mass and libido. I mean, the testosterone effects are found all throughout our body. It has a relationship and impact on mental clarity, on motivation, on mood, sense of well-being. Obviously, there are the sexual arousal, libido aspects of it, lean muscle tissue, energy level, exercise capacity, exercise recovery. That's a big one for men and women as we get older, that recovery from physical activity and exercise, and even relationships with sleep at times.
So what you're saying, basically, it can impact your daily life in many different aspects.
Absolutely.
What are some of the overall benefits, then, of replacement therapy?
Yeah, well, people that are suffering from either low testosterone levels or declining testosterone levels that they're now, sensing that and symptomatic from, it manifests itself differently for everybody. With some patients, it's very much sort of the mental side of it, of mood and motivation and well-being. With other patients, it's sexual symptoms. And with others, they're noticing a change in, body fat, loss of muscle, energy level. So replacing that hormone to optimal levels can have a huge impact in any one of those areas.
Okay, and with that in mind, how do you determine whether someone is a good candidate to go through with testosterone replacement therapy?
Yeah, great question. So I'll take you through. So a patient comes in for initial consultation. First thing we're doing is a quick blood draw. Our lab at Quarry Lake we do point of care testosterone testing. So we will have a testosterone blood value on that patient in 20 minutes. So they'll leave that visit knowing exactly what that level is. While that's processing, the patient and I sit down and we talk and we go over signs and symptoms and what they're experiencing, how it's impacting their life, the progression. Of course, we're going over medical history, but we're also looking at, exercise and physical activity, nutrition and dietary habits, sleep habits, stress management, supplement use, all of that. And then we get that blood level back. And so we review and we see, based on that value we see, do we think testosterone is causing some of the signs and symptoms that brought them in? If we think that is it, and testosterone therapy can be beneficial to the patient, we get started. Okay. Now, if we get started, we send out and we do a pretty expansive blood panel looking at all of the more common secondary causes of low testosterone levels, because a lot of those are easily reversible and the patient may not need testosterone therapy. In most cases, what we find out is as we're getting older, our body's just not making that hormone like it used to.
Okay. And you said that this can also be a conversation starter for other things. It can maybe trigger you to look at cholesterol or blood pressure. It may be one thing's triggering the other.
Absolutely. And like you said, when a lot of men come in and we're maybe their first visit and haven't seen their primary care in a year or two, haven't had their blood pressure checked, haven't had a blood sugar checked, we are screening for that as part of our evaluation process. So in some cases, we put what we're doing on hold and get them involved with primary care to get rid of, get these things taken care of.
Okay.
So the most important part is getting somebody into the office to evaluate. All right. Thank you so much. Where can we learn more?
You can go right to our website. It's www.goexpresscarewellness.com, and they can make appointments right through there.
All right, and it is on the screen. All right. Thank you so much.
Thank you.
Hopefully we get some folks to come and get that conversation started.
Great. Thanks so much for having me.
Thank you, Andrew.
Wellness Wednesday on WJZ at 9 is brought to you by ExpressCare Urgent Care Centers, a LifeBridge health partner.